you mentioned about internet and addictions. So basically, now we have seen that in the lockdown, we've actually had a increased usage of internet under the pretext of trying to work and get into the online classes and things like that. But has that really increased the suicide risk in the younger population? Especially with the gaming and things like that coming forward. I'm sure what has been your experience in that area?
Thank you, Sonali. Absolutely. I think that there has definitely been a shift towards more anxiety, more despondency, and more frustration among the population as a whole, as well as with the younger part of the population through this pandemic.
Right.
What I think most people are really struggling with is the lack of the out. Usually they would have a way of coping with the distress that they were experiencing. If it
True.
was an argument or fight within the family environs, going out, meeting friends would serve as a de-stressor.
Absolutely.
Today, that is a very, limited option. You can't really go outside to public places because not everything is open fully. There is not a lot of travel happening. People are still confined and restricted within those four walls. And in the last year and a half, we've realized how small those four walls can actually be.
Yes.
I mean,
Yes.
I live in a 2 BHK and I always thought that the space was big enough till we have now me doing online consults from home, both my kids doing online school from home, plus, the cook and the maid who come in to help out. It's really a very small space then at times when you look at the way we are all managing with the situation. So I can even imagine that it must be so much more difficult for other people who don't have this benefit. I've had so many patients reach out to me saying that I can't wait or I can't, come online for sessions because I have to talk about concerns and I don't have that much space within my home to talk freely.
Right.
Wherever I'm sitting and talking, somebody or the other would be able to hear me.
Absolutely.
So that has been a definite concern through the pandemic. I think this has also been highlighted in a number of studies that have been done during this period, which
Mhm.
talk about the risk of suicide, which talk about the number of people reaching out for helplines,
Right.
the number of people reaching out for mental health support.
Right.
In a way, I look at it as a positive because today people don't have to worry about taking the time off, traveling, coming to the clinic, waiting for the time to see me, and then finally consulting me, and then going all the way back.
That's
Today,
right.
it's much easier for them. But still, I am conscious of the fact that this entire situation has created uh, at least enough worry and frustration to contribute to an increasing amount of mental distress. Uh, I think a number of articles have also talked about the silent mental health epidemic that we are seeing,
Yes.
in addition to the actual COVID-19 pandemic.
Absolutely.
So there is no doubt that this period has added to the burden of distress that we are coping with.
Correct. And I think the younger population also, like you said, they feel very cornered. Adults still are able to cope up with a lot of things, but the younger population with zero socialization at some point in time actually became more withdrawn and, were not able to talk about their, regular issues, especially with their friends. And somewhere I think, their closing up led to a number of, rise in the number of suicides that really happened during the COVID times, right? Plus, I think the
Yeah.
academics also kind of dropped. I mean, they didn't have any ways where they were getting validated. They could, be in that, the institution and all of that. I think there was a complete gap that was there. So, yeah,
Correct.
so, absolutely. So, I think the younger generation was very, very badly affected as well.